2016 has been a great year for university research projects that not only engage with the public through the fieldwork that helps deliver them, but also makes a tangible difference to the lives of real people up and down the country. In the second of the biannual Engage Awards, organised and run by the National Coordinating Centre for Public Engagement, 18 varied, inspiring and significant projects spanning 6 categories were nominated at the NCCPE's 2-day Public Engagement Conference in Bristol. The Engage Conference looked at how higher education can continue to work with external partners to deliver successful research, and the nominees discovered at the award ceremony held on the first evening whether their project had won. A startling statistic at the centre of a remarkable project from the University of Glasgow is that 25,000 people in Africa die every year from rabies, and tragically, those deaths are largely unnecessary. Dr. Tiziana Lembo's project, developing rabies awareness in rural Africa, was a runner-up in the Engaging with Young People category and highly praised for the way it reached out to young people and worked with them to help prevent the disease in the future. After the award ceremony, I asked Dr. Lembo to tell me more about her work.
60,000 people die of rabies every year globally, and about 25,000 in Africa. So Africa and Asia are the continents where the problem is the greatest.
So, and is I mean the kind of the popular vision of rabies is it's carried by dogs. I mean, how is it transmitted?
Yeah, so rabies is caused by a virus, and it is transmitted through the bite of an infected animal. So it's a zoonosis, a disease transmitted from animals to humans. Domestic dogs are the main reservoir host, so the host that maintains the virus in most of the world, except in areas where domestic dog rabies has been controlled, in which case it has become a bit more established in wildlife populations. But in Africa and Asia, the problem that we see is very much caused by domestic dog rabies. So about 95% of bites are from domestic dogs.
And is it about how communities protect themselves? Is that the answer to the problem?
Yeah, well, the greatest tragedy of rabies and these figures really is that rabies is entirely preventable. If you are bitten by a suspect animal, you should wash the wound with soap and water and rush to the hospital. And if you receive emergency vaccination, what we call post-exposure prophylaxis, which is a combination of rabies vaccination as well as rabies immunoglobulin, which basically is injected into the wound to neutralize the virus. So if you do that, you are going to survive very likely, but you need to do it immediately, because the more you wait, the more likely it is that the virus gets into the nerves and then reaches the brain, and then once the symptoms appear, the disease is going to kill you, basically. So there is that, or you can vaccinate your dogs, and that is really the most effective way to eliminate the disease at source. But there are many problems related to these two strategies. In terms of human vaccination, rabies is really a disease of poverty. It affects communities that are very marginalized, that live in very remote areas, and they often don't have either the money or the infrastructure to reach hospitals very rapidly. Sometimes reach the hospital, and if it's a local hospital, a dispensary, they might not have the rabies vaccination, and they have to then travel long distances to reach bigger hospitals. So it is a major problem. Domestic dog vaccination is also potentially expensive if it's not provided for free. And people, again, need to travel generally quite some distances to reach vaccination points to get their dogs vaccinated.
And do patients, particularly in Africa, do rural African patients recognise the symptoms? Would they know that they needed to be treated for rabies, or might they think they have some other disease?
Yeah, so they will normally recognize an animal that might display signs of rabies, and that is really demonstrated. We've done a lot of surveys in communities, and people have a very good understanding of how rabies looks like. But that doesn't mean that they might know exactly what they need to do when they are bitten and if they are bitten. For example, when we looked at how aware people are of the disease and how to prevent it, the gap was really in terms of the prevention aspect. And in particular, only 10% of people knew that they they need to wash the wound with soap and water immediately, and that is a very that can really reduce the risk by 50%. Because you're basically just washing away the virus.
Simple.
Very simple. And a lot of people ask us, but what about if the water is dirty? It doesn't matter. It's really the mechanical process, and that's something that people don't know very much about. And so we thought, that's a good place to start. They generally know that they need to go to hospital, but there could be issues related to infrastructure, as I mentioned earlier, that might prevent that from happening. But the other thing is that when they go to hospital, they will trust the clinician, and they will not necessarily know what they are given. Very often they are given just anti-tetanus treatment, and they think that that's sufficient, and they don't necessarily know that they need to ask for rabies vaccination, especially if the clinician doesn't do a full investigation, or doesn't ask about the history, and the person might not declare that it was a dog bite, and they might just present with a wound without explaining what the history was. And if the victim is a child, rabies affects children more than anybody else. The child might not tell their parents how they were exposed, and even if they were exposed at all, because sometimes the bite might not be that evident or that obvious.
So have you seen any result? I mean, obviously you've been out in the field and you've done a lot of close field work, I would imagine. Has there been a tangible effect of the work that you've done?
Yeah, definitely. This particular project has really been looking how we can reach children and how we can increase awareness about the disease and how to prevent it. We've carried out a lot of activities that have involved very close engagement with a number of stakeholders. And I would say that there are, I guess, a number of key outcomes or what we call solutions, because we really presented the communities with the problem and we devised the solutions together. So there are a number of key ones. First of all, we've been able to establish some sort of support network that involves a lot of stakeholders that have a role to play in rabies prevention in children, but in the community as a whole as well. And this network includes medical officers, veterinary officers, development workers, as well as nurses, media, musicians, parents, grandparents, and so on. So children now know that they are supported in this problem, and they know who they can talk to if they are bitten by a dog, and what they themselves can do as well. And the network also includes teachers, so children who are lucky enough to go to school have also that opportunity. So a support network. The communities came up with some good suggestions as to how they might be able to face some of the challenges that they have. And for example, they told us that a way to reach hospitals is often through motorbikes. They're basically taxis, local taxis, and they said that that's often the only way that they have, especially if it's an emergency trip, and it's a little bit more affordable than others. And the motorbike taxi drivers that have attended our workshops have suggested that they would be able to transport children on their motorbikes for free if they are accompanied by their parents. The other thing that the taxi drivers told us is that they could, their association could help with awareness. They normally wear reflective jackets to be recognizable, and they were suggesting that they could put awareness messages on the jackets. For example, some of the key messages, such as washing the wound, which is such an important one, they could do that, or even on the motorbike itself, because they said that they travel such long distances that they could cover quite long areas. Then we have some information brochures, posters that we have created as part of this consultation process. So the communities have come up with their messages and suggestions, and this will be, they've already been used in some areas, but we would like to use them in dispensaries, for example, so that we are sure that if a person presents with a bite, the clinician talks them through what they need to do at that time, but also in the future if an incident of that type occurs. And this same material will be used in media offices, development worker offices, and so on. So and obviously in schools as well. And then we have involved local musicians who have created a Rabies song together with the children. So the messaging is very culturally appropriate. And again, some of the key information relates to what we identified as important gaps in knowledge.
Wow, you've achieved a lot.
Yeah, so we have quite a lot of outcomes. So many solutions. Well, I guess there are still areas that we need to work on. The media as well. The media are also very engaged in the process, so they'll help broadcast the Rabies song. But in general, they think that they have a key role to play in terms of Rabies prevention or health prevention, kind of health promotion in general in their country. But so what we're moving towards now is kind of bridging the gap between what's happening on the ground at the community level and the decision-making levels. And again, the communities themselves have come to us with a potential solution. They think that we really should be looking at working with associations like veterinary associations, medical associations, because they have a quite strong influence on policy decisions, and they have an important lobbying role to play.